If your nails have started looking different after 50, the mistake is not noticing it. The mistake is assuming it is just age. Some nail changes are harmless, some come from minor trauma, but a few can be your body's earliest visible clue that oxygen, circulation, or the heart itself is under stress. And that matters because the same system feeding your fingertips is also feeding your brain. The first thing to understand is this: nails do not diagnose heart disease, and they do not predict a stroke by themselves. But they can reflect changes in blood flow, oxygen delivery, inflammation, and chronic illness that deserve attention long before a crisis forces the issue. That is why cardiologists pay attention when nail changes appear together with fatigue, shortness of breath, swelling, dizziness, chest pressure, or reduced exercise tolerance. The nail is not the whole story. It is often the part people can actually see. Start with color, because this is where the most urgent warning can appear. If the nail beds look blue, bluish gray, or purple, especially if that change is new, it can signal low oxygen levels or poor circulation. In plain terms, your blood may not be carrying enough oxygen, or it may not be reaching the fingertips efficiently. That can happen in serious heart and lung conditions, and if it comes with breathlessness, chest discomfort, confusion, or sudden weakness, it is not something to watch for a few days. It needs prompt medical attention. A nail bed should usually look pink. When that healthy pink fades into a dusky color, the question is no longer cosmetic. The question is whether your body is getting the oxygen it needs. Now here is where many people miss the slower warning. Not every dangerous nail change is dramatic. Some develop so gradually that your eyes normalize them. One example is clubbing. This is when the fingertips begin to look more bulb-like and the nails curve downward more than they used to. It does not happen overnight. It builds over time, which is exactly why people ignore it. Clubbing is classically linked to chronic lung disease, but it can also appear with certain heart conditions, especially those involving long-term low oxygen levels or ongoing infection. The reason it matters is not the shape itself. It is what that shape suggests. The body may have been struggling with oxygenation for a long time without a clear explanation. Another sign that deserves more respect is the splinter hemorrhage. These are tiny, thin red, brown, or black lines under the nail that look like miniature splinters. A single one after banging your finger is usually nothing more than trauma. But if they show up on several nails, you do not recall injuring your hands, and they keep appearing, the conversation changes. Multiple unexplained splinter hemorrhages can be associated with infective endocarditis, a serious infection involving the inner lining of the heart or the valves. That does not mean every streak is a cardiac emergency. It does mean older adults should not shrug off a pattern of them, especially if fever, night sweats, weakness, weight loss, or a known valve problem is part of the picture. Then there are pale nails, and this one matters because it often hides in plain sight. If the nail beds look unusually white or washed out instead of pink, that can point to anemia. Anemia is not a heart disease, but it can push the heart to work harder because the blood carries less oxygen than it should. In younger people, the body sometimes compensates for a long time. After 50, and especially after 60, that extra strain becomes more important. A person may think they are simply slowing down with age, when in reality they are becoming short of breath on stairs, feeling mentally foggy, or tiring easily because oxygen delivery is not where it should be. That is where the brain enters this conversation. When oxygen delivery drops, concentration, balance, endurance, and resilience all suffer. There is also a nail pattern called Terry's nails, where most of the nail looks pale or opaque with only a narrow, darker band near the tip. This can show up with normal aging, which is why it should never be used as a self-diagnosis. But it has also been associated with chronic illnesses including heart failure, diabetes, liver disease, and kidney disease. That is a crucial distinction. A single nail sign is rarely specific. What makes it useful is context. If someone has Terry's nails and also has ankle swelling, breathlessness when lying flat, or unexplained fatigue, a clinician thinks differently than they would if the person feels entirely well. A simple check at home can add one more clue, but only if you use it honestly. Press on the nail bed until it blanches white, then release and see how fast the pink color returns. In general, it should come back in under 2 seconds. If refill is repeatedly delayed, that can suggest poor peripheral blood flow. But cold hands, room temperature, dehydration, and even anxiety can affect the result, so this is not a home diagnosis either. It is a signal. If the refill is slow again and again, and you also notice dizziness, cold extremities, weakness, or exercise intolerance, that combination is worth bringing to a doctor, not because the test proves a disease, but because it adds to the pattern. Here's what most people misunderstand. They look for one dramatic symptom and ignore the accumulation of smaller signs. Heart and brain problems often do not begin with collapse. They begin with patterns: lower stamina, more breathlessness, swollen feet, brain fog, paler nails, slower capillary refill, new bluish nail beds, unexplained streaks beneath the nails, a fingertip shape that is no longer what it used to be. None of these alone gives you a diagnosis. Together, they can tell you something important is changing. So what should you actually do? Look at your nails in natural daylight, not under a yellow bathroom bulb. Compare both hands. Pay attention to new color changes, new curvature, and streaks under multiple nails that you cannot explain. Notice whether the change is isolated or part of a bigger shift in your health. If blue or purple discoloration appears suddenly or comes with chest pain, shortness of breath, confusion, or one-sided weakness, treat that as urgent. If the change is gradual but persistent, photograph it. Write down when you first noticed it and bring it up at your next medical visit sooner rather than later if other symptoms are present. The real warning is not that your nails can predict the future with perfect accuracy. They cannot. The real warning is that many people wait for a catastrophic event because they assume the body stays silent until the final moment. It often does not. Sometimes the message is subtle. Sometimes it is sitting in plain sight at the end of your fingers. And if your nails look different after 50, the smartest response is not fear. It is attention, context, and timely action, because the goal is not to decode your nails perfectly. The goal is to catch a larger problem while there is still time to do something about it.